and good morning all. I'll be brief as we normally go through our case count and the nuances as the Minister has mentioned. As of the 4th of May this year, the total case count, as you have seen on the website, is 3,091 cases. Of this figure, it's an increase of about 372 cases since the last updates. And this, as usual, covers all cases diagnosed since the first case was recorded. Out of this number, a slight increase of those recovered has moved to about 303 cases and 18 deaths. There has been no COVID-19 related deaths since the last update, which was 2 days ago. This number leaves us with a total number of 2,770 active cases. When we say active cases, what does it mean? It means that the number of people that we are actually currently following up, that is exclude those who have recovered and those who have died, and that gives us about 1,770. There are still a number of people who may have left the country, so there are lots to follow up, and people who are also not being being reached. In terms of the cases recorded since the last update, 248 had come from Greater Accra, and that came from 20 districts instead of the 24 districts that were recorded in the last update. We have mainly from Accra Metro, 48, Korle Klote, 41, Ablekuma South, Ashaman, 17. Ashaman has come down now, and this comes as a 20 out of the 24 districts that reported cases in the last update. The rest of the country contributed about 124 new cases, and I'll share the details in the course of this presentation. After the total case, the 3,091 cases identified, 944 has come from the routine surveillance. That is those presenting with symptoms at the various health facilities. At the last update, that number was 919. 2,032 have been identified through the enhanced contact tracing, and as usual, the quarantine cases still adds up about 115. For the types of presentation and case management, we have about 2,765, accounting for about 9% of those cases presented with asymptomatic, or they had some mild symptoms, and most of them are being managed at our at-home treatment centers and mainly at the isolation centers. (618) of this number had come from the routine surveillance, and as much as 2,032 has come from the enhanced contact tracing. The number of people who are moderately ill still remains at 5, and that has not increased since the last update. When it comes to the positivity rate, we have a positivity rate. 3,069 persons have been tested from the routine surveillance, and we have 944, giving it a positivity rate of 2.85%. The last presentation about 2.9%. 102,803 has come from the enhanced contact tracing, and out of these 2,032 mentioned earlier have been confirmed, leaving our positivity rate of about 1.98%. Now let's get to the regional breakdown. Greater Accra, as mentioned, had an increase of 248, and I mentioned this that were created the main issues. Eastern region had one extra case, so they have a 95 now, as at 4th May, and that came from one of the hospitals in the Eastern region from routine surveillance. The Central region has had 2 new cases, 7 were from Infantsiman District, and 2 from Soweto and Cape Coast, and 1 from Moray. The Western region has had 10 more cases. The last presentation was 21, there are 31, and the cases are reported from Hunter West, cases from St. Martin de Porres Hospital, Ekwe, among others. And they are all mainly routine surgeries. Volta region did not add any more, it still remained 30 from the last update. Ashanti region added about 41 new cases, some from enhanced and some from routine surveillance. Kwabri East showed the largest number, 20, with Achumakwama adding 5 to the rest. Upper East, 7 new cases as of the last briefing. The case from Bolgatanga Municipality. Northern region has not had any increases. Remain 13. Northeast still 2 cases. OT has still 23 cases increase as of the last time. Western North has had some circumscribed outbreak, and so they moved from 54 to 56, having an increase of about 52 in Western North. This comes from a circumscribed area of a group of workers where we've had this number coming from. So as mentioned again, there's been no deaths since the last report. Of the 18 deaths, about 76% of them are males and 23% females. Living out of these deaths were above 60 years, and 4 cases were within ages of 40 and 59, and 2 cases aged between 25 and 39. I've also recorded deaths in the age of 15 to 25 bracket, and 1 less than 15 years. A significant proportion of these deaths are persons they all come with comorbidity, and that will mean they have either an existing condition, either a heart condition, diabetes, etc., and that has been about 84% of all people. Some of the conditions, as I mentioned, hypertension ranks the highest among them. We also had a case of liver disease, 1 had asthma, stroke, and other things. I also wish to add that, as the Honorable Minister said, we have been looking at, we wish we were able to do cases every day and be able to report on the positivity. But we also have the opportunity to go back and take samples and to see where the day that the samples were taken, how many were positive, which actually gives us things similar to if we had done it in real time. If you look at that data, we peaked around the 27th of April this year. And since then, the numbers have continued to come down till the last presented, as of yesterday. So that is showing that of the positivity, since peaking on the 27th of April, we have consistently recorded a decline until today. And we hope that will continue to be the case so that we'll be able to nip these cases, bring it under control, not actually control it. As I raised in my last press briefing, COVID is still not equivalent to death as people have perceived it. We want to encourage everybody to continue applying the protocols that we have done. We're also coming up with protocols that will guide people as to, if you're a hairdresser, if you're a barber, what exactly should you do to protect yourself? We know that it's not as simple, so we have protocols which will be out, as we mentioned last time, and share with the various groups. We already started engaging to share with them. So thank you very much.